Biggerstaff, good morning. My name's Penny. I'm going to be your nurse today. How are you doing? She opened her eyes when I spoke to her. So look at your Glasgow Coma scale. What does she get?
3.
Okay. Now, did she do it spontaneously, or did I have to tell her to open her eyes?
Spontaneous.
So she gets a
4.
4. Okay, very good. Okay. That. Can you tell me your full name and your date of birth?
Kathy.
Okay, Kathy. What's your last name, Kathy? Think it's normal? You know what your birthday is? Can you tell me when you were born?
In the summer.
In the summer. You know what month you were born in?
Perfect.
In the summer.
Okay. So could we say that she is oriented?
No.
Okay. Could we say she's confused conversation, that she's able to answer questions?
Yes.
Or do you think that she is inappropriate responses with words discernible?
Maybe that one.
No.
Like
She's confused conversation, but she's able to answer questions. She's just not answering appropriately. Words discernible would be if I asked her what her name was and she said the sky is blue.
You can understand what she's
So,
saying.
like,
but
she's-
right.
She processes what you're saying, but
She-
she just can't remember
Right.
what the answer is.
Correct. If I asked her what her name was and she said, blah, 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 then
Then
that's
that would be a 3.
incomprehensible speech.
I would have had a bad CBA with that one.
Yeah.
Oh, yes.
And it's pitiful. People who have expressive aphasia. I had a patient this past week in the hospital that had thank goodness she had a TIA, but for a moment in time she knew, her brain knew what she wanted to say, but the nerves would not allow her to get it out. And I was trying to do her assessment, and this poor woman was trying so hard to speak and say and answer, and she'd just shake her head. And you know she knows what the correct answer is, and because they get so frustrated and mad at themselves because their brain's processing it, their brain knows that it's November and that I'm Penny Hennessy, but my mouth won't let those words come out. And it's pitiful. So we gave her a 4 and a 4, so as of right now she's got an 8. Her best motor response. Okay. Kathy, can you lift your right arm off the bed? Okay. Did she do it?
I mean, yeah, but not good.
Not good, but she followed my command. She didn't lift her left arm, she didn't lift her leg, she didn't not lift anything. So what if she wouldn't have moved that? What would be your next step that you would do? She's laying here, I asked her to move.
Maybe see if she could do the other one. Would you see if she could do
Well,
the left one?
yeah.
Painful stimulus and see if she moved.
Yeah. So she didn't, alright, we asked her to move her right when she couldn't move it. Kathy, can you move your left arm off the bed? She didn't move it. I'm gonna pinch her. She reacted to painful stimuli. I really didn't pinch her. Or I could do a little nail bed pressure. That.
That's painful. And then
That. So she withdrew that. So that was a purposeful movement to painful stimuli. If she's laying here and she's unconscious, her eyes is closed, she's breathing, but I can't get her to open her eyes, I can't get her to wake up, and she doesn't follow any commands, I can't get her to wake up, so I go down here and I take my car keys and I dig them into doctors do it. That I don't advise y'all do it. I dig them in the sole of her foot, and she doesn't withdraw from that.
Doctors take their car keys.
Oh yeah. When you work in the ED,
Wow.
that
Such sweet people.
But now if I'd have pinched her on the toe here and she jerks her foot away, can I say that she withdrew from pain? I can't get her to do it any other way, but she followed my command. So she obeys my command for movement. So she got a 6, she got a 4, and she got a 4. So what's her score?
14.
She's 14. Would you say that she neurologically is probably okay right now? All right. We come into the patient's room. She's laying here. She's got her eyes closed. And I'm trying, Miss Biggerstaff. Miss Biggerstaff. Okay, she's not opening her eyes. She's not responding to my voice. Miss Biggerstaff, can you open your eyes? She doesn't open her eyes, so that one takes that out. Maybe she's hard of hearing. Miss Biggerstaff, can you hear me, honey? Can you open your eyes? Don't call them honey in the hospital, by the way.
They'll get you for that.
They'll get you for that. I'm sorry. Miss Biggerstaff, can you open your eyes? Okay, there's no response. We're not going to touch her face. That might do a little. Miss Biggerstaff, can you? Am I hurting? Okay. Miss Biggerstaff, can you hear me? She doesn't open her eyes. So she's going to get a big 1 because she had none. She did not open her eyes to any of that. All right. You think she's oriented? You think we can go ahead and rule out that she's probably oriented because she's not responding?
Oriented, she'd be disoriented, right? If you're
That-
oriented, you know what's going on, right? Am I
Correct.
backwards?
Yeah,
You're
right.
Right.
So
Yeah.
she'd be disoriented.
So we can't get her to wake up.
She's not really
She's
disoriented.
not,
oriented.
she's not opening her eyes when I
She said she
applied a
was.
little sternal pressure here. She's not opening her eyes when I'm asking her to do it. So we can assume
That she's not oriented.
that she's not oriented. You think she's confused conversation and can answer questions?
Nope.
Nope. You think that she's giving me inappropriate responses in discernible words?
Nope.
Nope. You think she has incomprehensible speech?
No.
Okay, so she would get a 1 for none. Do you think she's going to be able to follow my command? That, Miss Biggerstaff, can you open your eyes? She can't follow my commands. Do you think that she has purposeful movement? Okay, I'm going to give her a little bit of a pinch right here. That most of you get pinched, you want to snatch your finger back, don't you? No, she didn't do that. All right, so now we're going to apply a little nail bed pressure. I'm really not going to do it, but nail bed pressure hurts. Have you ever done that to yourself?
Yeah.
It hurts. She doesn't withdraw from pain. Now we get down to the posturing. This is what happens when somebody who has some severe neurological damage, their limbs start drawing in.
Mm-hmm.
So she's having, is that decorticate? It's going toward the cord, yeah. Decorticate posturing. And she would get a 3 for that. So she would have a Glasgow Coma scale of a 5. You can have a patient that is completely unconscious, can't respond to you at all. That's why I said earlier that a rock will get a 3. Because if you have a patient that they're just flaccid, they're laying there, they won't open their eyes, they can't speak to you, they can't follow your commands, they're not withdrawn from painful stimuli, they still get a 3. So do you think a 5's good? No. This patient has some major things going on. Do you think the corticate posturing is worse than decerebate posturing? Demonstrate decerebate.
No.
Why do you think that? Tell me, just take a stab at it.
Just because it's higher up on the
That,
scale.
yep, that's a good enough answer. That decerebate posturing's gonna get a lower score, so we know when they start doing this, the neurosurgeon had better be on his way in, or we better be flying this patient out if we don't have a neurosurgeon in-house, because she's got something major going on. She's probably not coming back to her baseline.
Not in season right now.
Okay.
There you go. See why you need that scale.
You're gonna do this on